Well, it is 12 o'clock, everyone. As you know, my name is Mac, and I help facilitate the Weight Loss Challenge. And I'm so excited because today I'm here with Certified Health and Wellness Coach Scott Bauer, who is going to talk about how health coaching can help you reach your weight loss goals. So Scott has been a health coach for 3 years now, and has had the pleasure to just help so many people, and I'm excited for him to help us all out. He has a great energy. He enjoys frisbee golfing, being with his family and friends, hiking, biking, skiing, playing racquetball, and just about any other activity outdoors and other people. So he's really diverse. And so he's going to help you guys today set a vision of your ideal health and wellness, try new things that may enrich your life, and set small, realistic goals that'll lead to big changes over time. So thank you, Scott, for being here with us today. I'm going to let Scott lead us through this presentation. So if you can be sure to mute yourselves during the presentation so there's no background noise, that would be great. And then if you have comments or questions, you can put those in the chat box. I'll be monitoring those on my end. And then at the end of the presentation, we can answer questions. So welcome, Scott, and thank you for being here.
Yeah, thank you so much, Mac. I appreciate you having me. Thank you to everybody on the call. Appreciate this opportunity to talk to you, tell you more about health coaching, and definitely would love to hear some questions at the end if you have them. So yeah, Mac told you a little bit about myself and things I like to do. I'm from Nampa and born and raised here. Just really enjoy getting outside, doing things, frisbee golf and things like that with my family and friends. Been working for St. Luke's for about 7 years almost, and 3.5 of those as a health coach. Just love the opportunity to get to know people. Originally, when I started, we were just coaching employees. Since then, we take doctor's referrals. I do health coaching through Lifestyle Medicine. Before COVID, I was working out there at the South Meridian YMCA with Lifestyle Medicine clients and coaching them. So there's so many different ways to access health coaching here at St. Luke's. Blows my mind. Most people haven't heard of health coaching, but it's been around for about 15 to 20 years at St. Luke's. It goes back much further than that, but at Luke's for quite a while. Let's see here. As far as clients, I've coached people in their 20s all the way up to their 80s. It's so fun just seeing how different everybody is and how health coaching can help anybody really. Before I became a health coach, I went through health coaching, and it was just amazing. It's quite an experience, so helpful to help you figure out what it is you want to work on in your life. As far as St. Luke's Health Coaching, we do have a total of 6 coaches at the moment, myself and 5 amazing women that work mostly in Boise. But we all work for coaching, doing it either through the phone or we can do video coaching as well. Both of those are options to people. So there's a lot more about coaching I want to tell you, but before I do, I was just wondering what you already know about coaching. What are some things that people have heard or read somewhere about coaching? Anybody brave and want to either say it out loud or type it in the box? I'll give you just a minute for that. Any thoughts coming through, Mac?
Yep, we just got one, Scott. So it says, have someone help you stay accountable. And then also, I primarily think of weight loss coaches. So maybe not necessarily a health coach, but a weight loss coach.
Yeah, thank you. Thank you for sharing that. Weight loss is definitely something that a lot of people want to work on in health coaching. And then we have a lot of clients who we never once talk about weight loss in health coaching. Our health and wellness incorporates many different facets. We'll talk about that in a bit. And any one of those is a valid area for health coaching. And what was the first comment? I'm sorry, I forgot.
Have someone help you stay accountable.
Sure. Yeah, definitely accountability helps. Anytime you have to check in with somebody or get to check in with somebody. Um, Great. Well, thank you for sharing that. Today in the presentation, I want to cover what is health coaching, how it could help you, and how to sign up if you're interested. And if you know someone interested, you're welcome to pass this on as well. So, health coaching is an evidence-based approach to engaging individuals around optimizing their health and wellness and managing chronic medical conditions. Um, as far as evidence-based, there's been quite a few research studies done about health coaching. A lot of them around type 2 diabetes, also blood pressure. I have some information on some of the type 2 diabetes studies. Um, they'll do a blind, double-blind study where they'll do health coaching for one group, no health coaching for another group, but the same educational materials. And in the one, it was a 3-month study, and the A1C had dropped by 1.07% with health coaching, and it was a third of that. It was 0.3% improvement in A1C without health coaching. So having that support and somebody to plan and help with behavior changes, it makes a big difference. The goal of health coaching is to support the individual using motivational interviewing, appreciative inquiry, and to help build their self-efficacy to empower patients to manage their health and wellness. Self-efficacy, if you haven't heard that word before, is your confidence in your ability to change. Motivational interviewing and appreciative inquiry are a few tools from a coach's toolbox, and it has to do with using things like positive psychology. It's much more motivational to focus on things that are working and to stay positive than to check in each time and just dwell on the negative and what isn't working. Most people were trained over time to have a negative bias. We think about what isn't working. When we set a goal, we linger on when it didn't work versus how many times it did work. So there's different things that we use and talk about what is working and helps with motivation. We talk about the trans-theoretical model of change. Big word that just means that when people come to coaching, when there's a decision to be made in your life, you might not always be ready to do that thing. You might be at the contemplation stage where you're thinking about it, but not quite at the action stage where you're ready to make the change. Maybe you're pre-contemplation. You're not even close to contemplating it. And eventually we want to move you to the maintenance stage. But there's different types of goals that work best, different materials that will help at each stage. And so sometimes, as weight loss was one of the examples, there's many different ways to go about that. And maybe you're contemplating one area, but more ready in another. So we would use the tools in our toolbox to figure out where you're ready and try to work on those areas. And it's always up to you. We always want to respect your autonomy as your health coach. And so making sure that, it's your choice. What is it that you're ready to work on, wanting to work on to build those self-efficacy skills? Coaches, we come with a lot of knowledge, with a lot of background information. Each one of our 6 coaches has a different background. Mine's lifestyle medicine. We have a diabetes educator, a dietitian. One was a personal trainer. One did music therapy for many years. So on and on, there's lots of skills that we have and can share. But we don't want to be the expert role. Our job is not to be the authority, just to educate you every time. We want you to define your agenda and to work on your problems. As coaches, we're here to partner and collaborate with you, co-create, cultivate change, but not to tell you what to do. Again, that goes back to autonomy and how to build motivation. And also with coaching, we won't be with you forever. So if we're always the one doing those things, then when you graduate coaching, a lot of the times, when you do a program and it ends, things start to fall apart. So we want to help build those skills so that you're able to do all those things on your own. So this slide is called Health is Multifaceted, or as I like to look at it, we're very complicated. Each one of us has many different things going on in our life, many different areas of health and wellness that are equally important. So we use the St. Luke's Wellbeing Wheel to talk about health. We use it in many different ways. At the first session, we would go through this wheel and we would have you score yourself on emotionally from 1 to 10, how well are you doing currently, and talk about that. And then we would talk about how are you doing occupationally and financially, intellectually, environmentally, spiritually, physically, and socially. So as we score those things, a lot of the times people feel like they're doing pretty good in areas, not so good in other areas. And if you connect the dots on the wheel, sometimes it looks kind of jagged. It makes life a bumpy ride. So then we can talk about, are you ready to change in certain areas? Where do you have more energy and want to change? What would be most helpful? And so we can work on any of those areas in health coaching. Sometimes people call their health coach their life coach because they feel like it's really impacting their whole life. We're not just talking about food and exercise. We talk about anything that's on your mind because we know that all of those areas impact your health. And if you're able to bring up your emotional health, it's going to make a difference to all sorts of other areas. Same thing with finances. If you're struggling there and we can set goals around it and improve it, that will help you to be able to do other things you want to do, and on and on. As people go through coaching, we'll come back to the wheel and they'll say, wow, it's much better here and here and here. And all I've done is worked on this one area, but it's so interconnected. So that's a tool that we use in coaching and refer to often. As we set goals in those different areas we were talking about, we always want to make sure that they're SMART goals. You're probably familiar with SMART goals. They're specific, measurable, attainable, relevant, and time-based. So when people say, I want to lose weight or I want to move more, we really get into the details, the nitty-gritty. Whether it's a 3-month goal or a weekly goal, we want to clearly define that. And I feel like a lot of the time it's in that planning as we're defining the goal that we set days of the week to do things, times, and that's where it becomes more real for people. That's when they start actually doing it because it's on their calendar, they're getting reminders. We have an app for coaching that you can use that will give reminders, you can track. All of these tools help make it more real versus just New Year's resolution where you say, I really want to do this thing, but there's no plan in place. So that's one of the steps that we do each time we talk. And in between sessions, we change things because just because it sounded good at the beginning doesn't mean it'll work in a couple weeks. So we're flexible, make changes, but we do try to keep things SMART. So this slide shows some of the different skills that people really improve on as they do health coaching. Quite a few different areas, all health related. So at the top, most people think of the physical activity, nutrition, and dealing with stress. Those are very important, and those do come into play a lot. But we also look at how to manage diseases, and we do track numbers if you want to. Nothing's ever forced, but if you want to track A1C, blood sugar, blood pressure, we see a lot of great positive results from the tracking that people do. That really improves for disease management, managing medications, making sure you're taking them on time. I have multiple clients where that's a goal for them right now. And just managing symptoms, emotions, communication. And a lot of the times there's resources that we can help connect people to as well. So we've talked a little bit about what coaching looks like in terms of setting goals and using the well-being wheel. The process itself is typically about 6 sessions. I have calls there, but they can be video chats as well. Typically it's about 3 to 4 months long. Oh, sorry about that. 3 to 4 months long, and the initial session is an hour long. It gives us enough time to really get to know each other and create that wellness vision, long term, what you would like your health to look like in a few years. And then we set a 3-month goal, at least one, sometimes more, but we definitely believe less is more, so starting small is great. So something you want to achieve in 3 months as you're getting close to graduation, and then something short term, where do you want to start right now? What do you know for sure you could do? Have follow-up sessions for 30 minutes. We check in on those goals and really talk about that experience. If it worked well, do you want to continue as is? Do you want to bump it up a little bit? And if something got in the way, what were those obstacles? What can we learn from them? What can we change so that you will be successful in this next couple weeks? So we make plenty of changes and just keep working together. At the final session around the 3 or 4 month mark, people have done a lot of great things, really improved their health, noticed physical changes, feel better, more energy, I hear a lot. And so we talk about how to just keep that going. What kind of support would that require? And yeah, those are really fun, the final sessions. Wanted to share a couple of things that I've heard from some previous clients. So here's some direct quotes. The first one is, I was skeptical when I first got your message. The message refers to people can sign up for coaching, but we also reach out to people who have had a recent doctor's visit and maybe their A1C or blood pressure was elevated. So when I call people, they're usually pretty skeptical. It's a free program and they don't know quite what to think about it, but this program gave me hope and made a big difference in my life. And this person lost 10 pounds in 3 months. She has more energy and self-confidence. The next person said, I jogged for the first time ever and feel like my younger self. I love hearing that, when they feel younger again. They lost 13 pounds, lowered their cholesterol, came off blood pressure medicine, and improved joint pain. So yeah, people are often able to reduce medication, come off of things. Last one, feel like I got my life back and I will never go back to my old ways of living. So this gentleman actually quit smoking, lost 12 pounds, lowered his triglycerides, his cholesterol, his blood pressure, and alcohol consumption. There were some pretty major changes there. Because he quit smoking during health coaching, we ended up going for a few months in addition to the 3 to 4 months that we normally do, just to make sure that he would be okay as we graduated, not worrying about him going back to smoking. And he was 100% positive he was fine. So so exciting to be able to read those out loud, share those with you, and this could be something that you might be saying here in a while if you want to try health coaching. So if you're interested and would like to sign up, there's a couple options. The first option is to sign up in Carium. So this is for people that don't currently have Carium. If you would be new to the platform, you can download it from the App Store or using the QR code at the top. And then use the invitation code SLHP for St. Luke's Health Partners, -HC for health coaching. By doing that, you will have your information sent to a bucket, we call it, where you'll be assigned a health coach. And so within a few days of taking that step, you'll hear from a coach and we'll get you scheduled. If you're already in Carium, that method doesn't work. You're already there. So in that case, you would just want to email healthyucoach@slhs.org and then tell us that you want to do health coaching. If there's anything else specifically you're looking to get out of it, please put that in there and we'll get you connected to a coach. So thank you so much for listening. Glad you guys are here. And if you have any questions about health coaching, I'd love to answer those to the best of my ability.
Thank you so much, Scott. For pretty much everyone on this call, they should have Carium already because they're in the weight loss challenge, which I put a comment in the chat box. The nice thing about that is you don't have to download another app. they can just put you in the health coaching group, and you're already familiar with the app, and can move on from there, which is super slick and helpful. So we put a link in your Tuesday health tips on registering for health coaching that is available through the Weight Loss Challenge program, which is pretty great. We've seen such a great turnout from all of you to participate in that, and we are super excited. One question that did come up during your presentation was, what is lifestyle medicine? And so what I did, Scott, is just put the long, lengthy definition of lifestyle medicine in the chat box, but figured you could maybe just elaborate on that, your specialty, a little bit more.
Thanks, Mac. Yeah, lifestyle medicine is an awesome program that St. Luke's offers. It's out of the South Meridian YMCA. It is its own clinic, and lifestyle medicine is run by Dr. Jennifer Schalls. She's been working through the cardiology department for many years at St. Luke's, and has been pushing to open this clinic of lifestyle medicine. And the purpose is that, yes, there's definitely a need for medications, but quite a few health issues can be greatly improved, sometimes reversed through lifestyle changes. Same things that we embrace here as health coaches. And so they have many experts there, as well as health coaches. So they have exercise physiologists, counselors, they have dietitians, they do cooking classes, they support whole food plant-based eating, and so they teach that. So they have all these experts, and they say, if you go through the program, try these things out, it will improve your health. You will see your lab results improve. Weight will come off. Not everybody goes there for weight loss. People go there for all sorts of issues. And it is in Meridian, but they also can work through Teams. They do a lot of online training. So I'm trying to think if there's anything else super important I'm missing. They're just fantastic. If you want more information, Mac, you said you posted something about that?
Yeah, so I put just the long definition in the chat box, but that was it. That was a great explanation. There's a lifestyle medicine clinic here in Twin Falls as well, and across the system. So depending on where you're at in the state, you should be able to get access to their teams. And I just put it in the chat box to elaborate on what you're saying. Research has shown that 70% of chronic disease, not infectious disease, is due to lifestyle, not our genetics. So we really do have a lot more control over our overall well-being as we age, which is exciting, and lifestyle medicine really helps with that. So pretty cool. Is there any other questions on health coaching? Maybe you already signed up for health coaching and you're just kind of wondering how it's going to work, what it's going to look like, or maybe just more specific questions to how a health coach can help you with your current goals in the weight loss challenge. It says, is it free? Pam says, is it free to use a health coach for St. Luke's employees?
It is completely free, yes.
And for spouses, correct? Or
that is correct, yes.
Yeah, that's great. Good question. Any other questions? I know in the weight loss challenge you're doing group coaching. Do you maybe want to elaborate a little bit on group health coaching versus individual coaching, Scott?
You bet. So group health coaching utilizes shared knowledge and experiences. So we will also use the well-being wheel and talk about our health and all the different areas. We will also come up with a wellness vision. Each person will create their own, set their own goals. So there will be time for group discussion about these things. We'll also talk about how do you navigate obstacles, having a positive attitude and how important that is. So there's a little more built-in education to group health coaching versus one-on-one when it's more tailored to what your needs are. So we try to address a certain topic, have an open discussion about it, let people share, and then there's just a little homework at each one where you're setting your own goals, coming up with your own plan. We communicate between those group coaching sessions. So people will be using Carium and be able to follow up there. Usually at the end of group coaching, people have comments about how much they learn from each other, how they feel closer and supported in those ways. Met new people that they want to stay in touch with. So yeah, it's another different way of doing this coaching. And if you're that social person that really wants something like that, we've got a few groups going on now, and there's going to be another one down the road. I think it's filled up too, but if there's a huge need, it's something that we will definitely pursue.
Okay. Do you see better like health outcomes or improvements in health outcomes with the group coaching? Is there, a reason behind that versus just the individual coaching?
I would say that both get great outcomes. I wouldn't say one's better than the other. Some people really want one-on-one and they don't want to participate in a group. And for other people, they're just starved for social interaction right now. And so that's a best fit. So yeah, I think just whatever your personality is, whatever you feel drawn to, do that one.
Great. There is another question in here. Beth asked, do you have to have St. Luke's insurance to get free coaching, similar with CHIP?
Yeah, so there are a lot of insurances currently that fall under the St. Luke's Green Banner. Don't know how much people are familiar with that or not. It's our value-based plan. And so if you're interested, just send an email and we can look up and see if you qualify or not. If you don't, health coaching is also through lifestyle medicine, like I said. Maybe that's a good fit for you. And so, yeah, there are some insurance restrictions, but I don't have all the plans in front of me. There's a lot that we include, so odds are pretty good that it would be something we could work on. And I feel like every year we add another plan or two as well. The goal is so that eventually we can just coach anybody who wants it. Unfortunately, that's not the system that we currently have, but we're working on it.
Yeah. So when in doubt, still reach out and double check, just in case.
Yeah.
Okay. Great. Are there any other questions? We have about a minute left, so if there are, we're happy to stay on and answer away. Okay, well, I take silence as a no, but if you guys think of another question, after this webinar, don't hesitate to reach us at the Weight Loss Challenge at slhs.org, and we'll be happy to answer those questions. Scott, thank you so much for your time today. It's always a pleasure talking to you, and we'll look forward to just hearing how the group health coaching sessions go with everyone moving forward. So thank you for your time, and we'll talk soon. Thanks, everyone.
You're welcome. Thank you, Mac. Thanks, everybody. Bye-bye.
Bye.